Hello, my name is Emma Leifler and I'm a Swedish researcher. I work at the University of Gothenburg as a teacher educator, but I'm also connected to KIND, Karolinska Institutet in Stockholm. And I'm gonna present some research for you today. My research, the field I'm working in is within educational psychology, more explicit inclusive education for students with neurodevelopmental conditions, such as autism and ADHD. And I'm gonna share my presentation for you now. Here it is. My research area, inclusive education and how we can improve inclusive education and how we can implement interventions aiming to improve inclusion. Previous studies I've done is a systematic literature review of looking at the learning environment and the adaptations for autistic students. I've also conducted an intervention for teachers learning in improving teachers' inclusion capacity. And also I've been working with an instrument called Inclusio, measuring inclusive education from the views of the students, their parents and teachers. And finally, the research I'm going to present for you today, the social skills group training in naturalistic settings. So towards inclusion excellence, social skills group training in naturalistic settings. And you can see my name, but I also have some co-researchers, Kristina, Anna, and Sven. This study I'm presenting today, the project, the objectives are to contribute to the understanding of educational inclusion and also for students with social impairments and investigate if an intervention can improve inclusion. And we do that by exploring social and ecological validity of social skills group training. And the program is called School Contact and is derived from the clinical program Contact, also social skills group training. And we use the theories from the work by Wolf, and we have categorized social validity in these categories: satisfaction, acceptability, and feasibility. And that is how the participant in the intervention evaluates the worth of the intervention. And that is for implementing interventions and doing that in different settings as good as we can. The research is published in International Journal of Environmental Research and Public Health, and the title of the explicit study is Social Skills Group Training for Students with Neurodevelopmental Disabilities in Senior High School, a qualitative multi-perspective study of social validity. Short introduction. There are challenges in regular school settings. Inclusive values are important, and inclusive education is the ground in democracy and also in the right to belong, to attend. And for students with neurodevelopmental conditions, there are some challenges. If we don't identify the challenges, for example, delayed diagnosis might delay the support, and also not understanding the condition in a broad way also might be a risk of not adequate support. And if we don't give adequate and sufficient support, there are several risk factors as depression, social exclusion, school absenteeism, and also furthermore self-harming behavior. So we need to look at this, the lack of adequate and sufficient support, and also teacher competence. Social environment at school. School is a social environment, and the social environment is important to have a feeling of belonging and being one that counts, one that people and other friends listen to. And previous research shows that children with NDC socialize less with peers And also boys with NDC are explicitly rejected by classmates and girls are overlooked. And it's important to improve the social environment, and there are interventions aiming to improve inclusion, both targeting the environment and targeting the individual. And also research show that the psychosocial environment in school is a neglected area where we need to implement more interventions to improve the psychosocial environment and therefore also inclusion. If we look at inclusion in the broad view, where we look at belonging, achievement, and well-being. The methods. Here you can see School Contact, the program, the manual is written in Swedish, I think, and also Contact, the social skills, the clinical version of the program. So this work is social validity we examine, and the participants, they are in this ongoing random control trial, where they have social skills group training and also a control group with social activities. And in this study, we have deep interviewed 13 students from the random control trial, and both from the control group and from the active training group. And furthermore, 5 teachers and 2 school management staff to look at their perceptions of the interventions. And the method, as I said, interviews that we transcribed and we coded according to thematic analysis, social validity, as mentioned before. And we used the program Innovinc for the coding and for the sharing the codes. So, and then we did the comparisons between active training group and social training group. And furthermore, also we compared the in real life training and the digital training, since the program was transformed into virtual during COVID. Here you can see the participants, their gender, and also their diagnosis and comorbidity. And as you see, the first students, the adolescents, are from School Contact, the training group, and the rest from the activity group. And the interview settings were school, physical, and then digital as the training was transformed. And also the age from 17 to 20. So they are senior secondary high school. The training formats, they are 8 students with 2 to 3 teachers. Training is 12 weeks with 3 sessions every week, 15 minutes each, 36 sessions totally. And they are structured with a structured format with an opening round and closing round. And some examples, you can see further details in the article, but there are theme-based group discussions, psychoeducational elements, social missions weekly, individual social goals, role play and emotion recognition training, social activities, interaction training, and cognitive training. And as I said, we had the random control was 1 active group and 1 social group, where the social group had more only social activities and some discussions. The results according to satisfaction, acceptability, and feasibility. There were some barriers, and there are barriers such as time, unclear assignments, lack of flexibility in the program, and it's resource demanding. The positive indicators are, for example, the school is a safe environment, the teams were adequate, and the program enhanced well-being, self-awareness. Teachers, as well as adolescents, got new concrete tools to use, strategies, and also showed enhanced participation in activities and in the school environment. And according to social behavior change, there are the improved social environment. The whole school environment was described as improved, and also strengthened relationships among student and student and teacher, and also improved school attendance, less loneliness, and more knowledge about social impairments, which then can be aligned to teachers' inclusion skills, since it was the teachers in school that was trained by professionals and conducted the training in the school settings. And according to implementation, they were described as trust, no waiting list, generalized knowledge. The knowledge was spread within the school environment, and also practical, like it was close and no extra time for travel. The results, conclusions and results. Social skills group training is advantageous in school settings for many reasons. It's a safe environment with reciprocal relationships. It's close and no extra time to travel. And there are natural existing pairs, both within the training and also outside the training, and for further developing friendships. And a serendipity is teachers as facilitators, strengthening the relationships, but also more awareness of social impairments and more tools to handle and help with inclusion. And furthermore, finally, the results showed then improved interactions in the school environment, and school attendance was improved. And also the in real life training was described as preferable by both teachers and students. However, the digital was also beneficial, and more beneficial for some students, the students with more social difficulties than others. Further discussion. School, as I said, is a social arena, and for inclusion, we need to look at the social environment. We need to work with these since social environment is important and is aligned with students' well-being, attendance, and belonging, and in the next step, also the academic achievement. And this study shows, and previous research also, the general knowledge of neurodevelopmental condition in mainstream setting is poor, and especially how to adjust the learning environment, where especially the psychosocial environment is poor and needs to be improved. And also there are interventions that we can implement in naturalistic settings, and we need to use these methods more inclusive settings and also by teachers, since social skills group training is more common in clinical settings. However, we need to implement it in naturalistic settings where the students spend most of their day. And also interventions like this can raise the awareness, further lead to the whole school approach and the broad, more spread knowledge. And also we need to look at and understand learners' characteristics, what they need. And we need the dualistic approach where we look at the individual and the training, and also very important, the environment, and the environment meeting the students' new skills. So, and also including students in research like we did here is for evaluate the interventions themselves, is for avoiding poor implementation and finding interventions valuable to implement in different settings. Thanks for listening, and every child is one of a kind. Be kind. Bye.